Early Saturday morning, hundreds of Long Islanders who oppose Obamacare rallied once again, this time in Huntington. They were met by a small contingent of about 25 Obamacare supporters. Although both sides agreed from the outset that they would keep things low-key and civil, quickly, the crosstalk became spirited.
Rationed health care. It's going to be rationed. The government has an interest in you dying early. It'll save Social Security. It'll save Medicare.
And do you know where that tax money goes? Let me finish. That tax money goes to the general fund. If the tax money went back to Social Security where it belongs, Social Security would have been fine.
Among the more contentious points of disagreement was the likely long-term impact on the nation's private insurance industry, resulting from the inclusion of a so-called public option, a key feature of the various bills now pending in Congress.
The insurance companies will not be driven out of business. What will happen, however, is they will be forced to become competitive. Competition, the American way.
Others expressed concern that the nation's Medicare and Social Security programs are already on the brink of insolvency. They would prefer that Congress fix those programs first, before rolling out a new program with a $1.5 trillion price tag.
You know, it's very easy to say Medicare works when the liability that's being built up for it is going to be taken from my children and their grandchildren. If it doesn't work, if it costs a fortune, then you can't afford it.
As the national debate over government-run health care has become increasingly strident, many are now doubting that the current House and Senate bills can be modified enough to satisfy the growing chorus of opponents. When asked for a suggestion on how the bills could be improved, Stephen Flanagan, executive director of CSA, organizer of today's rally, put it bluntly.
Scrap them. Scrap them and start from scratch. No, there is no way you can save these bills. If you go down and read these bills, not only are they allocating billions of dollars, they're actually advocating creating additional trust funds. Remember the Social Security Trust Fund? Yeah, they did a great job with that one, right? Now they want to create medical trust funds. What happens to trust funds? It's nothing but a way to raid the Treasury, to develop, take our tax money and waste it on other issues. There's 4 trust funds. There's additional czars. They want to set up dozens of bureaucracies. They want to set up healthcare commissions. And they actually want you to call a federal bureaucrat before you call your doctor. Absolutely not in America.
Commenting further on the war of words that escalated in the last week, he reacted to the president's suggestion that opponents of his approach to health care reform just get out of the way and let him clean up the mess.
How dare a president of the United States go out and say that we should not have dissent in the United States of America? The land of the free and the home of the brave, our president has come out and said, be quiet.
As the health care debate rolls on, both groups are expected to turn out at a series of rallies planned for the month of August. They include a number of consecutive protests at congressional offices island-wide on Saturday, August 22nd. Those we spoke with today said they are more determined than ever to turn out and to have their dissenting views heard, listened to, and respected. This is Steve Bongiorno for the Long Island Alternative News Network in Huntington, New York.